A 58-year-old male patient, Mr. Eric Azarcon, is in the hospital after suffering from a heart attack. He has been diagnosed with severe coronary artery disease, and the cardiologist has recommended coronary artery bypass graft surgery to restore blood flow to his heart. However, Mr. Eric is hesitant to proceed due to fear of the procedure and the recovery process. His family, particularly his wife, Mrs. Azarcon, is insistent that he undergo the surgery, as they believe it's his best chance at survival. This conflict between Mr. Eric and his family is creating tension and uncertainty. The healthcare team, the nurse, cardiologist, surgeon, and client or family must come together to navigate the patient's concerns, family dynamics, and medical realities. Throughout the interaction, the transactional model of communication is applied, focusing on continuous feedback, and the S-bar framework is used for clear, structured reporting. Trauma-informed care, anti-racism, and culturally safe communication principles are applied to ensure that all voices are heard and respected.
The interaction takes place in a hospital meeting room with Mr. Eric and his wife sitting across from the healthcare team, wherein there is an open, supportive atmosphere where both the patients and the family's voices are equally heard.
Good afternoon, Mr. and Mrs. Azarcon. I just want to thank you for taking the time to come here and meet with us today. We understand that this is a difficult time for both of you, and we're here to help you work through whatever concerns that you have about the surgery and to ensure that you feel supported in any way.
I'm just not sure about going through this surgery. I'm afraid of what could happen during the procedure, and I've heard complications that can arise afterward.
But Eric, the doctor have told us that this surgery is our best chance. If you don't do this, you could have another heart attack, and it could be worse.
I can hear that there are a lot of strong emotions involved, and it's important that we address both of your concerns, Mr. Eric, and your need for reassurance, Mrs. Azarcon. Our goal today is to listen and to support both of you. Hello, this is Nova from the medical department. We are here today to discuss about Mr. Eric's upcoming coronary artery bypass surgery. There is a conflict with Mr. Eric. He is hesitant to proceed with the surgery due to concerns about risks and recovery, while his wife, Mrs. Azarcon, is advocating for the surgery, believing it is the best option for his health. Mr. Eric has severe coronary artery disease and was recently hospitalized after a heart attack. The cardiology team recommends the CABG surgery to restore blood flow to the heart and prevent future heart events. Mr. Eric has concerns about the surgery's risk and recovery for the process, and while Mrs. Azarcon wants him to undergo the procedure to improve his chances of survival. So the patient, Mr. Eric, is anxious about the surgery and feels fear of the complications. He's also unsure about the recovery process. But Mrs. Azarcon feels strongly about the surgery and is the only way forward, which has created tension between the both of them. And we need to address both the medical facts and emotional concerns to ensure Mr. Eric feels comfortable with his decision. I also recommend that we have a discussion where Dr. Alejo can come explain the medical benefits and the risks of surgery in more detail, and also Dr. Gavina can answer any questions about the procedure, and we can address the emotional and psychological aspects to ensure that Mr. Eric's autonomy and dignity are respected. It is also important that we focus on shared decision making for everyone. Okay, thank you. Mr. and Mrs. Azarcon, Dr. Alejo and Dr. Gavino will be joining us today to address both your concerns regarding the surgery, and they will be arriving in a bit.
Hello, Mr. Azarcon, Mrs. Azarcon.
Hello.
Hello, how are you?
Yeah, I'm good. How about you?
I'm good, thank you. So, first thing, I'm Dr. Alejo, your cardiologist. I'm with Dr. Gavino. Hello.
Hello.
Nice meeting you. The surgeon. So, Nurse Nova told us that you are hesitant for the procedure, the coronary artery bypass surgery, and I understand that the surgery is a big decision and it's perfectly normal to feel hesitant. We're here to make sure you have all the information you need to make the best choice for yourself. I also want to acknowledge that this situation may trigger past traumas or fears, and we want to approach this in a way that honors experience and feelings.
Thank you for your understanding. Because I've had some bad experiences with medical procedures in the past, it's just hard to trust that things will go okay.
I completely understand your fears. It's important to feel safe and supported throughout the process. We will be here for you in every step of the way, and I will ensure that we will take all the precaution needed to minimize the risk of during the procedure and the surgery. If you're comfortable, I'd like to walk with you throughout the procedure so that you can understand what you feel and what will happen.
Mr. Eric, we've heard about your concerns about the surgery, and we're going to provide you with the information that can help you make an informed decision. I also want to make sure that you feel heard and safe throughout the process. Let's work together to figure out the best plan.
Surgery is a big decision, and we know that it can feel overwhelming. We will explain everything and answer all your questions, but I want you to know that there are no wrong decisions here. We want you to be comfortable and empowered in your choice, Mr. Azarcon.
I need some time to think about all this. I know the surgery is serious, but I just need to process it.
That's completely okay, Mr. Eric. We'll give you all the time that you need. If you have any more questions or concerns, or if you need support, please don't hesitate to reach out to us. We're here for you. Mr. Eric and Mrs. Azarcon, we will provide you with the information you need and respect your decision-making process. Mr. Eric, your autonomy is important to us, and we want to ensure that you're in control of the decision that's right for you.
Whatever decision you make, we will support you, Mr. Eric. We understand that decision is very personal, and we respect all your wishes.
And we want you to know that we'll be with you every step of the way. No matter what you decide, you're not alone in this.
I just want you to be okay, Eric. I don't want to lose you.